Hello everyone, Dr. Matt Ed, and today we'll talk about point-of-care ultrasound normal apical 3-chamber view. We'll talk about how to obtain apical 3-chamber view, and we'll talk about the information that's obtained from an apical 3-chamber view. To obtain the apical 3-chamber view, pretend this stuffed animal is on its lateral decubitous position on the left side, and here we have the probe pointed at where the apical impulse is, and you have the indicator pointing towards the right side of the patient. So if you look at a clock, the probe indicator is pretty much pointing at 10 o'clock. The information that you can gather in the apical 3-chamber view includes mitral valve and the aortic valve are shown in the same imaging plane. You see the left-sided chambers with LVOT. The basal, mid, and apical portion of both the inferior lateral and anterior septal LV walls. And if you put color Doppler, you can assess the presence and severity of mitral regurgitation and aortic regurgitation with its respective valve locations. And you can also measure the LVOT volume time integral, also known as VTI, which is determined by placing the post-Doppler gate just proximal to the aortic valve. And with that, you can calculate the cardiac output and also the valve area. This is a 3-chamber view with labels. So here we have the left ventricle, this area. And here we have the left atrium. This is the descending aorta over here. And here we have the ascending aorta, which is this area. And these are the aortic valves. The top one is the right coronary cusp. The bottom one is the non-coronary cusp. And this is the anterior mitral valve. The posterior mitral valve should be over here. This side is the RV. And the walls wise, over here, this is the anterior septal wall. And this area is the inferior lateral wall. Here we have a video of the same picture from before, without labels, and this is a normal apical 3-chamber view. Here's a video of the prior video of the apical 3-chamber view with color Doppler. You can see that the blue is going across the aortic valve, and then the red is going across the mitral valve. And that's normal. Remember, BART, B-A-R-T, blue away, red towards, in relationship to the probe. So if you think about it, during diastole, the mitral valve opens and the blood flow goes towards the probe, therefore it's red. And during systole, the blood flow goes across out of the aortic valve and away from the probe, and that's blue. And remember, the probe is up here. This is a normal heart with normal valves, so it doesn't indicate any mitral regurg or aortic regurgitation, as there is no cutter change. You can see that there's no blue going across the mitral valve, and there's no red going across the aortic valve. If you thought this video was helpful, please like, subscribe, and look out for my next video. Thank you for listening.